Hi, welcome to my presentation at EVMS Research Day. My name is Alejandra Vargas and the case I will present is entitled It is Never a Spider Bite. I would like to begin by providing a brief overview of meningococcemia. This is a rare infectious disease characterized by non-specific symptoms and exam findings ranging from transient fever and bacteremia to fulminant disease with death within hours of the onset. Even when it's treated, meningococcal disease kills 10 to 15 infected people out of 100, and those who survive, about 10 to 20 out of every 100 will suffer disabilities such as limb loss, deafness, and seizures. The clinicians must be alert to this diagnosis, even though it's rarely encountered in clinical practice due to vaccination. It's because unrecognized cases could have serious consequences not only for the patient but also for healthcare workers. Why healthcare workers? Well, we may be exposed to infectious secretions when we perform activities such as endotracheal tube placements or suctioning, so don't forget the post-exposure prophylaxis. In this case report, we analyzed a patient who initially presented to the emergency department for concern of a spider bite related symptoms. However, invasive meningococcal disease was diagnosed after we got more history, physical exam, and labs. Let's start. A 30-year-old African-American male with a past medical history of alcohol use disorder presented to the emergency department with confusion and severe myalgias several days after sustaining a reported spider bite. He was looking diaphoretic, tachycardic, toxic, tachypneic, hypoxic, and also he had motor lower extremities that were cold to touch. Initial labs, as you can see here, showed leukocytosis, thrombocytopenia, acute renal and liver failure, rhabdomyolysis, and lactic acidosis. Cardiac enzymes were significant for troponin elevation. We started vancomycin and ceftriaxone for meningitis. We ordered CT head, which was normal. However, the chest, abdomen, and pelvis CT showed bilateral parenchymal opacities, right pleural effusion, and bilateral perinephric stranding concerning for pyelonephritis. An echocardiogram was significant for left ventricular ejection fraction of 30% with a global hypokinesis. Overnight, the patient developed worsening of the nuchal rigidity, diffuse muscle weakness, and progressive bilateral lower extremity purpuric rash, as you can see here. CSF from lumbar puncture was notable for severe pleocytosis. PCR of the CSF, as well as blood and urine cultures, confirmed Neisseria meningitis. The suspected spider bite was ultimately determined to be the initial manifestation of purpura fulminans, as you can see here. The patient improved with antibiotics and supportive care. However, after 5 days, the patient developed bilateral lower extremity paralysis. MRI pelvis that is shown here, demonstrating myositis, hemorrhagic myonecrosis, and cellulitis. After intense physical therapy, the patient recovered some strength. However, he ended up being discharged to a skilled nursing facility. So just to remember, as an invasive organism, meningococcus has the potential to rapidly disseminate to all organs. And as I mentioned before, the presentation can vary wildly and may initially appear benign, but invasive meningococcal disease carries a mortality rate exceeding 10%. Meningitis presents with fever, headache, and myalgia is the most common presentation, as everybody knows. However, other presentations include purpura fulminans, which occur in 5 to 25% of the cases and is fatal in 20 to 70%. As one of the presentations, we also have disseminating intravascular coagulation, arthritis, pneumonia, as well as myocarditis and myositis. These last two are less non-complication, maybe because we need invasive biopsies to get definitive diagnosis. So just to summarize, this case highlights the classic findings of meningococcus, including meningitis, purpura fulminans, and multiple organ dysfunction, as well as rare features including cardiomyopathy, myositis, myonecrosis. In addition, our case serves as a reminder of the potential of more advanced disease to become more common due to changes in vaccine acceptance. That's why physicians must be alert so they can initiate prompt treatment. Thank you everyone for listening to this presentation.